Good afternoon. Welcome to the show. I'm Jim Flyzik. During today's show, we will discuss critical issues facing government and industry leaders in using information technology to improve healthcare and healthcare services. With me on the show today are Dave Bowen, the Chief Information Officer, Defense Health Agency, the Military Health System, Dr. Michael McCoy, the Chief Health Information Officer in the Office of the National Coordinator for Health Information Technology, ONC, Dr. Neil Evans, the Co-Director of the Connected Health Office, VHA, Office of Informatics and Analytics, Jeff Baxter, the Chief Technology Officer for the Americas at NetApp, Monica McEwen, the Federal Director at Qlik, and Mark Jones, the Senior Sales Director, Healthcare, CA Technologies. Let's talk about some progress being made, things that are happening over there. Let's start with Dave Bowen over at Defense Health Agency. Dave, can you cite some examples of where you see progress being made in using information technology to improve healthcare?
Sure, Jim, and good afternoon to you. That's a pretty broad question. I mean, as I thought about getting ready for the show, I mean, so many things came to mind, all the stuff that's being done with patient interaction on the web and telehealth and everything. But one of the things I think that struck me as I've talked to my colleagues, both in government and in the commercial sector, is an increasing focus around analytical capabilities. How do you analyze, massive amounts of data to improve population health and care of your patients?
Right.
In the military health system, we're bringing together the military health capabilities of the Army, Navy, and Air Force into much more of a single enterprise construct. And we're using analytics to look at the performance of our direct care system, our hospitals and clinics, across all of the services. We had a mandate from the Secretary to do some of this analysis, and so we've developed a set of metrics. And for the very first time, we're looking comparably across our network of 57 hospitals and 250 clinics and whatever, excuse me, using the same set of metrics,
right,
and obviously pulling a lot of data to have to do that. And we're seeing some really interesting results as we go through this analysis. So we're going to be focused on developing improvement plans and looking at how do we improve our operations, function more like a system, more like a commercial system would function, and certainly look at ways that we can work with our facilities to help improve our patient results, our patient quality, and our outcomes.
Yeah, terrific. Fantastic. I know when we do our shows on big data, we hear about all kinds of analytics that are being used these days. Absolutely, absolutely. Dr. McCoy, let's talk about some progress there. I know that HHS had been working to transform the health system into one that offers better care, smarter spending on health dollars, healthier people. Tell us a little bit how your role at ONC fits into that effort and some progress you see being made.
Thank you, and good afternoon. ONC is the agency that helps coordinate care among all of the different federal agencies, and we help promulgate standards that other agencies, such as the military health system and the VA, use in interoperating not only in their own systems, but also with the healthy communities that are across the nation. A large portion of care delivered both to veterans and to active duty soldiers occurs outside of the actual military system. Mm-hmm. And it's important for us to engage and ensure that the information needed by clinicians treating patients is at the point of care, where they need it. So ONC, I think, has a number of people that have been embedded from the IPO with DOD and VA. We've had some transfer of our people back into the IPO there. Right. So we have a very strong bond between our agencies in making sure that interoperability helps deliver the promise of better care at the point of care. The learning health system is what we are shooting for as a nation to ensure that the information through big analytics and other modalities is provided to better inform the right clinical decision being made throughout the system from a population perspective or from an individual perspective.
Excellent, excellent. Fantastic. We'll hopefully talk a little bit more about some of those standards and interoperability, because I know how important they are to the mission. Jeff Baxter over NetApp, how's a company like NetApp playing in this? How are you supporting your customers and helping make progress in the use of IT for better healthcare?
Yeah, it's a great question. So, I mean, NetApp's focus really is on the data management, right? Mm-hmm. Getting data to move seamlessly and securely out to, as you were saying, Dr. McCoy, out at the actual point of care, right? Getting it all the way from the data center to the point of care. So if you look at programs we've done with, for example, the Navy, the clinical desktop program, so that you can have expeditionary forces that actually have access to their electronic health records, right? So that you can do things, and it's a first for things like the battalion aid stations where they can actually have real-time access to their electronic health records, right, at the point of care. We've done things that help agencies move radiological images directly out in real time into the waiting room or into the rooms with the physician, right? So if you can save just a minute or 2 minutes or 3 minutes from each potential session, right? That adds up to days and days and days of time. And at the end of the day, it adds up to more people getting care during the day from the same staff, right? So whenever we can enable sort of that seamless data mobility and that seamless access all the way from central data centers out anywhere anyone needs care, that's really what we're focused on.
Yeah, I said this on a couple other shows too, we're moving into a world where the time to make decisions is approaching zero. I mean, in terms of the time you have to move something forward. Dr. Neil Evans over VHA, what are some of the progress you see over VHA in addressing the use of IT to improve healthcare?
Well, thanks, Jim.
Sure.
At VHA, we have really a single-minded focus at the moment on the veterans' experience of care and providing broad access to care. And I think one of the places where we're most excited about the application of health information technology is in connected health technologies or telemedicine that really increase patients' convenience, allow patients to access their data and information in their daily lives where they actually are. More than 32% of VA patients every year are accessing a virtual healthcare modality or having electronic visits with their physician through a secure messaging exchange or participating in a telemedicine encounter where they don't actually have to drive many hours to one of our central facilities. And so that application of communication technologies and the movement of healthcare out of our facilities and into patients' homes and workplaces and daily lives is, in my mind, one of the most exciting areas in health IT these days.
I do too. When you just think about it, especially wounded veterans or people where it's a burden to get from place A to B, whatever, telemedicine and the technologies associated just has to be a tremendous benefit to healthcare in general. That's great news. Monica McEwen at Qlik, tell us first of all a little bit about Qlik and how you're playing in this and making some progress and helping move these programs forward.
Yeah, certainly. Thank you. So as Mr. Bowen mentioned, analytics is really at the forefront of healthcare today, and Qlik is a COTS-based data discovery and visual analytics solution. So what we do is take data, massive amounts of data, and aggregate it so that it can be delivered not only at the point of care, but also at an administrative level. And really, collecting data today has such an amazing power to really improve lives, even more so in healthcare than any other industry we support, in that we can take the data and make it actionable and define a clinical pathway to improve the patient's care. So a great example of this is in Germany, our solution is being used, and they've rebranded it from QlikView to MassekView, and it's being used for mammogram screening. Oh. And so they've been able to collect the data not only on the patient from the EMR, but also from the PAC system, as well as from the billing system and other systems that collect data on individuals and on a potential clinical pathway, and then marry that up with a cancer registry in Germany. So they've been able to then better screen women who are coming in for mammograms and been able to reduce mastectomies by 12% across our patient population.
Fantastic, fantastic. Yeah, I like that stories when you get down to really it's saving lives is what we're talking about here. Exactly. Mark Jones over CA. How's CA playing to the progress being made here with health IT?
So it's really very interesting. We've coined a term, or maybe we didn't coin it, but we use it called the application economy. So all large organizations are developing their own software houses. So it's important to develop new services and new applications. So what we found is you have these islands of information. So how do we take this information from all these disparate sources and make them available to improve outcomes? So we have a model where we provide governance and security over APIs, or just the interfaces that you use to build the services. And then we have applications that help you develop these services. So as a healthcare provider, when you have to develop new applications around your medical records, you have to make them mobile enabled. We provide a method to make that easily achieved without having to re-engineer or reorganize your information. And then we provide a wrapper of security around it as well. So we have found that GE, Walmart, all large organizations now are developing new applications at a more rapid rate. which plays into our ability to secure and provide that DevOps solutions that you need.
Yeah, boy, you hear about DevOps everywhere these days, and agile, and speed. Let's talk about profiling some specific programs. Our listening audience always likes to hear about, say, a program that you would think of as one that you would point to as being successful. Let's start with Dr. McCoy. Michael, is there a program that you would point to, a specific program? I know you mentioned the Learning Health System and a little bit about that, but is there a program that you would like showcase, saying that here's an example of something, a program that's really making some progress?
Well, again, as ONC helps develop standards and push out things, we do it as a broad, overarching things. We engage with both states, helping with their health information exchanges. So there are opportunities for local, state, geographic areas that have data exchanges. Those play in well to exchanging information that's critical in certain areas. The state of Utah, as an example, has a very robust HIE underway from the state perspective. And each of these are then engaging with, again, VA, DOD, et cetera, in supporting the care of not only active duty, but retirees, dependents of retirees, et cetera. So all of that is, I think, critical for success, and it points to some bright spots where there are good areas of interchange and data.
Excellent. So you do the framework. You steer, they row.
Correct.
Yeah. Dr. Evans, is there a specific program that you would point to that you think is really making a difference in moving forward? You mentioned telemedicine, which I think is obvious. Is there anything else in that vein that you would point to as being something you think is going to make a big difference?
Sure. I think another a program that I would highlight that actually is in the same theme of telemedicine. It's extending the reach of our healthcare system and bringing VA healthcare resources to the community of the veterans that we serve. Is a collaborative effort. This is a public-private partnership that we have had over the last 2 years with Walgreens, extending the administration of flu vaccines for free to veterans at any Walgreens across the country. So more than 8,000 locations with Walgreens across the country. Any veteran can now walk into a Walgreens, receive an influenza vaccine. But I think the exciting part about this from a health information technology perspective is the interoperability that we were able to pilot initially in 2013 in Florida and now nationwide to allow that immunization to be given and within 24 hours it to be electronically recorded in our electronic health record, and the performance measure of how well we do with influenza vaccines each year without any human involvement. For me, this is really great news. As a primary care provider at the Washington, D.C. VA Medical Center, I used to have to process big stacks of paper that would come in with patients saying, I got my flu vaccine here, there, everywhere, and I'd have to click boxes in the electronic health record to record that. That all just happens seamlessly right now because of this public-private partnership that extends our reach.
Wow, terrific, terrific. Yeah, that's just kind of a feel-good kind of a story there, you know, something that you feel like it's doing something good, and the government doing something good for the veterans, and I think that excellent. Dave Bowen, how about at the Defense Health Agency? Do you have some a specific program that you would say, here's an example of a program where we're really making some headway?
Yeah, Jim, sure do. What we've done in the military health system is implemented a secure messaging solution for both our providers and our constituents. I think Dr. McCoy mentioned a lot of our folks get their care outside of our direct care system, and that's true. In fact, more than half of them do. And this secure messaging system is a way that we've established to be able to link our internal providers with external providers to provide a reference to an external care provider for one of our military members to go outside our direct care system, be seen by the physician, and then have that medical result come back into our internal system. The patient also gets a copy of the record and everything, and so we're getting our folks more involved in their own care, and we're establishing tighter links between our internal direct care providers and the external providers. So it's a
Back
good way
to
of getting data.
Back to the idea, using the technology to move data quicker back
move
and
data
forth.
around, exactly.
Dr. Evans, you had a comment on that?
I wanted to follow up on that. We have the same experience in the VA. We have had a secure messaging system, and it's changing the way healthcare is delivered. In fact, this morning, before I came here to our radio broadcast, I was answering secure messages to patients and delivering care before I had even started the workday, which is changing relationships between patients and their healthcare team. I think it's not overwhelmingly complicated technology, but secure messaging is technology that just increases the openness of communication between healthcare systems and between the healthcare systems and the patients that they serve.
Yeah, well put. Well put. It's people ask me, I don't know what time when I work anymore. I have no idea what my hours are. Who knows? It's the phone rings. I get emails 24/7 whenever I answer them. I guess I'm working. I'm not sure, but Monica over at Qlik, what do you think is a specific program? Can you think of something that you think is a specific program you'd point to that where you see some difference being made?
Yeah, certainly. So we're doing work today with Army MedCom, and we're seeing a lot of collaboration across the regions. Rather than spending time aggregating data, the time is being spent actually analyzing the information using our technology. And we're seeing really analytics is really changing the way in which healthcare is being delivered and improving patient care. So a great example of this is Children's Hospital of Atlanta, where they have when babies are premature, for anyone that has had a premature baby, they're probably aware of this, but the retina doesn't fully develop because the way in which the retina develops has to have the right level of oxygen and the right level of light, and that is only in the mother's womb in which the retina can fully develop. And so CHOA, as all children's hospitals do, perform a procedure on babies in the NICU. It's a very quick procedure. It's easy to perform. However, the baby is in distress as a result of this procedure because they're opening up the baby's eye, and there's things in the baby's eye at a very early age. And so up until recently, vitals are usually dumped after a couple of days because they're simply too large to store. And so as a result, the way that this procedure was performed is the doctor would look at the baby, they would perform the procedure, a nurse would look at them, say, baby's no longer in distress, and move on. But CHOA has started collecting this vital information and then analyzing it. So they now have a Hadoop cluster which can hold this data, this massive amount of data, and a Qlik analytics engine on top of it. And they were able to determine that the baby's actually in distress for 27 minutes post-operatively.
Oh, wow.
And yet they were moving past the baby after about 6 minutes because the procedure took 4, and they'd stay around for a couple of minutes. So they've really changed the way in which they're handling this procedure, and they now have a nurse stay back with the child as the ophthalmologist is performing the procedure.
Yeah.
So a really interesting way of
so
improving
kind of an
patient care.
aha moment of learning something that they had not known before because of the analytics.
Absolutely.
So, Mark Jones, what do you think? Can you point to a specific program that you think is making a difference here?
Certainly. I'll go back to the whole notion of DevOps. So when you're rolling out a large, be it an electronic medical record, electronic health record, there are always interfaces outside of your control that you need access to in order to develop that application. What we provide is the ability, and we provided it with the DTE, the ability to simulate the traffic in that interface. So you don't have to wait until the application's fully developed before you do your end-to-end testing. This simulation enables that testing to take place earlier, so you avoid the sort of end-user experience you had with ACA. It's just a method to mitigate risk, to make sure that you take into account all those different interfaces that have to work properly in order for a fully functioning healthcare system, because it's not a closed-loop system, as everyone on the panel knows. There are a myriad of other interfaces that you need to take into account, and we've addressed that issue with a lot of organizations, including some of the organizations within the DTE.
Okay, terrific. And Jeff, I want to hear from you on this too, but first we need to take a short break. You're listening to the Federal Executive Forum on Federal News Radio, 1500 AM. Welcome back to the Federal Executive Forum on Federal News Radio, 1500 AM. I'm Jim Flyzik here with Dave Bowen from the Military Health System, DHA, Dr. Michael McCoy from ONC, Dr. Neil Evans from VHA, Jeff Baxter from NetApp, Monica McEwen from Qlik, and Mark Jones from CA Technologies. We're talking health IT and how it's being used to improve health systems in our country. We were talking about specific programs. We heard from everybody, but we ran out of time for that commercial. We didn't hear from Jeff Baxter. Jeff, can you identify a specific program you think that exemplifies progress being made in using IT to improve healthcare?
Sure, I'll give you just a couple quick ones.
Sure.
I think one is that really is nice is Mercy Health System, for example. One of the things we've been really focused on in NetApp is trying to standardize and consolidate and do private cloud offerings and all sorts of different offerings around healthcare. So they actually developed, a standardized, centralized EHR service, and they were so successful at doing that and scaling it that they turned around and then offered EHR as a service to other smaller hospitals that might not have been able to set it up, and other smaller clinics, right? So in the process of creating a service that worked well for them and scaled well for them, they were able to extend that to others. The other one on the government side really is working with the VA. We've tried to develop what we call basically like a data center in a box, right? So if you go out now to all of the 192 VA hospitals, right, they have an option of placing this data center in a box to run their entire operations. And it really gets down to, when you get down to brass tacks, small, medium, large, extra large, right? Or, grande, venti, trenta, right? And I think I needed a trenta this morning. But, so it simplifies those operations, so it gets us out of the business of having to wire infrastructure and set everything up from scratch every single time. And it really lets us focus more on a higher level on the analytics and deploying applications and all the things that actually drive value out to the patient.
Excellent, excellent. Let's talk about some lessons learned. I would think that there's been this big push in using technology to improve healthcare, but I'm sure there's been a lot of things you're learning along the way. What are some of the lessons learned to date with using these IT initiatives that might help other colleagues and other industry players that are working these industries? Let's start with Dave Bowen at Defense Health Agency. Dave, what are some of the things you're learning as you go along here?
Well, Jim, I think you just heard from Jeff the word standardize and consolidate. I think as the discussion goes forward here, you'll probably hear a lot more about that. Standards are hugely important, and Dr. McCoy's work with the ONC and helping set standards for the country, I think is hugely important to moving us all forward so that we can more easily and readily share this health information. We're actively involved with the VA and in doing a lot of this work. We're using standards where they exist, and in other areas where they don't exist, we're working with ONC and VA to help create the standards. I heard in a meeting that standards are like toothbrushes. Everybody's got one, but nobody wants to use anybody else's. And we really need to agree on standards and start speaking the same language. So I think that is certainly a lesson learned. Consolidation's another one. And the one that we're learning in the military health system, and I think it's absolutely crucial, is that we're talking IT, we're talking technology, but what we really are doing is we're changing culture, we're changing practices, in some cases practices of medicine, and we've got to absolutely have physician involvement. These things can't be seen as tech-driven projects. They got to be, business re-engineering projects or business development projects, and be thought of that in that way as really business improvement with the key participants having a very large role in the involvement.
Well said, well said. That culture issue comes up every radio show, and and I think it was Robert Kennedy said 1/3 of everybody's against everything all the time, if it means change. So it's a tough issue to work through. But in that standardization, and I know I was at Treasury back when we were just harmonizing taxes information between federal and state, and just getting people to harmonize what people call different things was just a major undertaking. Mm-hmm. People had no idea just how difficult some of that stuff can be. Dr. Evans, what are some of the lessons learned along the way as you work your way through these issues? What are you learning that you pass on to others?
Well, I think I'll follow on a little bit of the thread of what Dave was talking about at the end there, that about the importance of the engagement of the consumer of health information technology in its development, implementation, deployment, the necessary change management. I think one of the lessons that we continue to learn is that health information technology is exciting from a technology perspective, but it's more about people than it is about technology.
Excellent
because
point.
The users of these technology are people. And our goal is to improve health for all of us. And And so pursuing our design of these systems with a human-centered approach, getting the right stakeholders in the room, doing rapid cycle, iterative changes, developing systems in a way that works for the user is absolutely critical for the adoption, for the necessary culture change. Understanding the workflow in which these systems exist is in many ways the recipe for success or failure with health information
That
technology.
is well said. You know, it's nothing like asking the ultimate user what they want before you actually build the system. Dr. McCoy, what do you think are some of the lessons you're learning as you work your way through some of these issues?
Well, I think Anil is absolutely correct, and anything I would say on that would be duplicative, so I will just I will build on that. However,
Okay.
I think some of the lessons learned, we're driving towards a person-centric approach. Because in fact, I think the health of the nation is more than simply dealing with sick patients. We have to get to a healthier nation, and so that is both the engagement of individuals before they become sick. That is engagement of individuals who are providing care for others, whether that is a family member or as a caregiver for a spouse or anyone else. And part of the goal of ONC has been to help drive that engagement. So we think that the technology, again, just a tool, is really not the important part. It is the engagement of everyone who's involved in the healthcare delivery system to make better informed decisions all along the path, whether that is the individual making a healthy lifestyle choice. Mm-hmm. Should I eat this? Should I exercise more? What do I need to do to take care of this particular illness? Right. To the clinician providing the care, so they are providing from a evidence-based and evidence-guided approach, population health, et cetera. Those are all important lessons that we have to factor in as we develop the tools to support that.
Excellent. Well said. Well said. Jeff Baxter, what do you think? What are some of the lessons learned along the way here?
Yeah, as we look more and more at standardization, and I love the line about the toothbrushes, all you need to steal their license from it, you know, either way, depending on your terms. One thing that's really interesting for us is as we talk to our customers about cloud, right, it's become such a buzzword, and everyone says cloud as though it's singular, but it's really plural, right? They're clouds, right? There's no one cloud, and that everyone's speaking different languages, right? It's virtual Tower of Babel, right? So none of them are using the same standards, even though the cloud is supposed to unify and provide services. So what we really, from a lessons learned perspective, have been working with agencies is to find up front, what are the requirements, right? What are you using the cloud for? How are you going to interface with it? Who's going to be on the other end? And really trying to build this sort of cohesive data fabric, right, with a data dictionary ahead of time and ways in which all the different clouds are going to interact, such that when you're putting data into the cloud, when you're connecting to it, it isn't lost in the cloud, right? And that agencies and eventually end users still have their own governance and still have their own control over that data. And at the end of the day, the real test is, can you bring it back out of the cloud once you've put it in there, right? So that's really one of the lessons that we've learned is the cloud is absolutely one of the biggest tech disruptors and probably one of the biggest disruptors of technology in the last couple decades. But it's one of those things that if you approach it up front with standards in mind and data dictionary and all the different ways of dealing with it, it produces extremely successful results. If you don't do that, right, we've seen situations where people get out into the cloud and then they can't come back. Yeah, right. And that's the more dangerous one.
Yeah, excellent points. Yep, and we've done a number of shows on cloud, and we've been through very similar scenarios that you're talking about right there. Mark Jones, what do you think? What are some of the lessons learned along the way?
I would really, two areas, culture and contracting. What we have found is it's difficult to change a culture, as I know the panelists are well aware of. Mm-hmm. And people are accustomed to doing things a certain way, and you mentioned disruption in the cloud. There are lots of innovative products out there, but people are not aware of them. And when you bring them to their attention, there's still this culture of this is new, though it's innovative, I don't have the competency on staff, and I don't know if I'm going to outsource all of this as well. And then the other notion of requirements. User requirements are extraordinarily difficult to define. We try to use Agile to help address those requirements to give you more flexibility. And we have found that unless you're very prescriptive in your contracting, oftentimes people won't risk an innovative product because it wasn't explicitly written into the contract, though you can bring something to bear that could save tremendous time and effort and mitigate risk. So those are issues that culture and contracting that still need to be addressed. Though there's progress, there's still a lot to be done there.
Yeah, you know, when I headed up the IT team on the reinventing government thing, and we dealt with culture a little bit, and we had people actually telling us it takes like generations of change for culture change to actually, be effective and take place. And I agree with you on getting innovative products in. I think, a lot of times it's the way the acquisition's done and contractors set up. There's no incentive to bring in some of these innovative products because the contractor's set up to sell labor hours. So bringing innovative products might reduce the number of labor hours. So a lot has to be thought through on some of these things, on how you're going to set contracts up so that there is encouraging innovation to be brought into the government. Monica, over at Qlik, what do you see some of the lessons learned along the way here, things that you're encountering as you venture your way through this world of health IT?
Yeah, I think there's a couple of themes. People and standards are two of them. A CIO of a major health organization said to me recently, data is our biggest asset. It's taking that data and making it actionable in less than 3 clicks, which is what really helps drive our clinical improvement. And I think there's a fine balance between standardizing without stifling innovation. And so it's that delicate balance between the two where you have to have governed data sets that are delivered to decision makers so that they can, in 3 clicks, get to a decision point. But you need to do that in a governed way in which the data, everyone has confidence in the data that's being delivered to them. So I think there's a lot of things that industry is doing that is really helping to advance that. Organizations like Johns Hopkins and UCSF that have really embraced data as their biggest asset and are using analytics to drive improved decision making, but doing it in a governed way.
Yeah, terrific. I feel like you were talking to me there because I'm very impatient. If I have to click more than about 3 times, I'll go on to something else. I'll say I'm not using this application. They need to make it more efficient for me to use it. Let's talk about some of the challenges out there. Some of the things that are still difficult, things that you need to work your way through. Let's start with Dr. McCoy this time. And Dr. McCoy, what are some of the the challenges out there? I know we've talked about interoperability. We've talked about standards. I know there's challenges getting them, and I've lived those kinds of things. Are there some challenges, or either elaborate on those or other challenges that you put out on the table that you think we still need to overcome to get to where we really want to be with this?
Certainly. As everyone else has said, it is a culture change that is really the primary issue. There are technical standards that need to be further developed. Not every standard that is being put out is mature. ONC with the standards, we released a roadmap this year and a standards advisory for the best available standards, LOINC, SNOMED, things of that sort that are developed by standards development organizations. And they're the geeks that actually do the work to make things as a standard. But things do still have to mature, be tested, and be able to be put in. Yet that's really not the major issue. It's business practices, it's contracts, it's culture, it's other things that prohibit or preclude data moving freely. It's when my organization has all this intellectual property and data, and we want to hold on to it because it's our intellectual property rather than sharing it with the rest of the community. And that leads to what has been called the data blocking or data freezing. So it's there, but you can't get to it unless you really apply a lot of heat. And that is a real challenge. And again, it's more culture, more business practice than it is actual technical. So that I would see is one of the major challenges that we have to address moving forward.
Yeah, I like the pun. Data freezing, you need heat. Very interesting. Let's talk, Dr. Evans, what do you see at some of the major challenges that are out there that are yet to be overcome to get where we need to go on this stuff?
Right. Well, continuing on the theme of culture change and how health information technology, the challenges of the continued application of our health IT systems, I think part of it is, health information technology is still is changing the way medicine is practiced, and it's changing the way patients can experience medicine. And I see this happening in our clinics. We increasingly are having to find time for clinicians to do desktop medicine, to actually spend time not just sitting face-to-face with a patient, but actually answering secure messages, reviewing data. We have a lot of really tremendously powerful tools to help improve the health of our populations, but figuring out how to integrate them into the traditional healthcare delivery system is a challenge that we're making a lot of progress with, but it's something that I think is still going to be a long journey for us.
Yeah. It's all coming home now. I think when I go to the doctor, I've got a couple doctors, primary care physician and so forth, and gets out his laptop, complains about, they make me do this, I can't see, and I'm sort of witnessing the culture change. Yet we know the next generation of doctors coming up through college who are living on technology are going to be a whole different infusion into the environment that's going to create yet another culture clash of sorts as they work their way in. Dave Bowen, what do you think are some of the major challenges that you bump into every day that you still need to get through to get where you want to go?
Well, I'll certainly echo some of the comments made by my fellow panelists here. I've got 4 C's that I came up with in looking at this question: cost, culture, compliance, and commitment. Okay. We talked about culture quite a bit. Certainly compliance with standards as they evolve is something. And maybe one other C to add would be competition, and that is as we look at what major healthcare commercial providers are doing and travel around the country looking at how they implemented their electronic health record, in preparation for our electronic health record progress, we asked about information exchange with the system next door, and we found surprisingly little information was being exchanged. And the conclusion I came to was it's competition. The systems want to capture a certain patient population and want to keep that population in the system. So obviously, it's not in their best interest to share information with competitive providers. So I think that's a challenge that I think we're going to have to deal with. And maybe through the regulatory process come up with some way of lessening the penalty for sharing data from a competitive standpoint.
Yeah, I agree with that too. I just can't wait for the day that I go and I get a new doctor and I walk in and they don't hand me the clipboard with 15 pieces of paper to fill out.
Exactly.
I walk in and they say, "Well, we got your electronic record sent from your prior doctor. You're all ready to go. Come on in." Hopefully that day is not too far out there into the future. I want to hear from our industry guests on this same question, but first let's take a short break. You're listening to the Federal Executive Forum on Federal News Radio, 1500 AM. Welcome back to the Federal Executive Forum on Federal News Radio, 1500 AM. I'm Jim Flyzik here with Dave Bowen from Defense Health Agency, Dr. Michael McCoy from OMC, Dr. Neil Evans from VHA, Jeff Baxter from NetApp, Monica McEwen from Qlik, and Mark Jones from CA Technologies. We're talking health IT and how IT is helping improve healthcare across the country. We've been talking about progress and specific programs and lessons learned, and we've been talking about challenges. We heard from our government folks about this, but I'd like to hear a little bit from the industry perspective. What are some of the, let's start with Mark Jones this time. Mark, what are some of the challenges that you are facing that you still need to overcome to get to where you really want to go with this stuff?
So it's this notion of speed, right? You're developing new applications via an agile methodology, not the old-fashioned way where it was waterfall. You had months and months and months and perhaps years to develop an application that the end user would consume. So developing these applications at a much more rapid rate, and they're developed that way because of the burgeoning influence of mobile, and it's not even burgeoning anymore. Mobile is here. Mobile is only going to get larger and larger. So that puts tremendous stress on the infrastructure. The infrastructure has to be standardized, as was mentioned on the panel, and it has to be a utility. So this notion of I'm going to build a new service that my end user is going to consume, I need to make it secure, and I need to make it seamless. Those are the items that we're struggling with and looking to address, to make the end user experience as seamless as possible.
Yeah, I think that's what it's all about. Again, that's next generation of coming up is going to expect things to be right there, Monica McEwen, over at Qlik, what are some of the challenges that you face and that you need to overcome to actually get where you want to go with supporting your customers in this area?
Yeah, so I think one of the biggest things that we see as a challenge today is the data sharing piece. And it's not only data sharing with industry and federal, but even inside the own walls of an agency. So the agencies in which we've been able to work with that have been most successful, we've been able to access the legacy systems. We've been able to access all of the different data systems and bring them into an interface that's simple, intuitive, and in which someone can get to a decision in less than 3 clicks. And we've had great success with that across HHS, VA, and DoD. However, there's still that barrier, which is the memorandum of understanding and the data use agreements, even within their own agency. And that really stifles the ability for an agency to get access to all this information and harness it to make better decisions.
Yeah, I know data sharing, people think is, how hard can that be? But when you really drill down and look at, what some of the implications of data sharing, and even people just understanding what data means and the semantics around various data, it gets to be a far more complex issue when you actually start drilling down to try to understand, what that means. We bump into it all the time with the show we do here on intelligence and information sharing. When you get into intelligence sharing, it gets really difficult as to how you move that information around. Jeff Baxter at NetApp, what are some of the challenges you see that still need to be overcome? Some of the things that you need to move out of the way in order to get where we want to go with this?
Yeah, so great question. When you were talking about your physician coming into the room with the laptop, and
right.
it was reminding me, my brother actually for several years, his job was to go in and train physicians on using their brand new EHRs, and the stories he used to tell at the dinner table when we go out about his days were colorful, to say the least.
I bet they
right?
were.
So all sorts of different personalities. But as that happens and we get more and more data into the system, and even more importantly, as we get far more automated data feeds into the system, what one of the big challenges we're seeing is we haven't defined the data around the data, right? The metadata that actually defines what that data is, what its value is, what its value is to the clinician, what its value is to the end users. And without doing that, we run into those issues where there's this huge tension between costs, right, and holding on to data. I mean, you mentioned, Monica, about the vitals being tossed for newborns after a couple of weeks or something like that, right? Because you weren't sure, and people weren't sure of the actual data of that particular information, or the particular value of that data. So trying to get that data, define metadata. Once we have that in place, then we can build engines, right? Then we can build data engines and medical rules engines that manage to keep the data where it needs to be for the length of time it needs to be, drive it directly out to the endpoint, to the end user, without massively inflating the budget. Because we could easily, we could spend the entire U.S. budget just on storing the amount of data,
right,
we're going to create. And so we need to be intelligent, though, about how we classify the data and how we store the data so that we can drive the most value. And I think that's really going to be one of the challenges. It already is a challenge, but I think it's going to be one of our biggest challenges over the next decade, is that data just continues to grow and grow and grow.
Yeah, I know the analytics thing has come up over and over here, and I know going all the way back to, again, the reinventing government days, we took a look at all the information being collected by satellite by like NOAA and NASA and the DoD and whatever. And back then they were using like less than 5% of the data they were collecting. The rest of the data was just, being, I guess, just thrown away. Yeah. And somebody started to look at that with analytics and realize that data is highly valuable to other agencies, other people. So, and it started this movement of how can we start, using this data in other ways and sharing this data and using the analytical tools that are out there today. We want to shift gears a little bit here. On all of our shows, we like to end by trying to look out into the future and say, all this effort going on with health IT and modernizing IT to improve healthcare. What's it going to mean in the long run? What will it mean to our country? What will improve? What will things look like out in the future? And so let's look to the future. And what do you see as the vision for using technology in the future? Paint what it's going to be like. What's all this work going to result in down the road? Let's start with Mark Jones over CA. What's your crystal ball look like there, Mark? Where's this all going?
You need ubiquitous, seamless access to all your information. Unfortunately, it's not contained to one authoritative data source. So you have pockets of information spread throughout the country, spread throughout the world, conceivably. People receive care from not just the VA or not just DoD, but from commercial providers as well. So eventually, there will be that ability to build customized services for personalized medicine. But at the end of the day, you need to use that personalized medicine to improve outcomes and for evidence-based medicine. And as long as that information is locked up in islands that you do not have access to, that's going to continue to slow down the growth of improved outcomes. And that will be addressed, and hopefully it will be addressed sooner rather than later. And standardization is a huge issue around that as well.
Yeah, so I can think of more tools and things for me. You know, it won't be the generic kind of a visit anymore. It'll be a visit tailored to address my issues. Monica, what do you see as down the road in the future? Where's this all going? What's the future going to look like as a result of all these efforts to improve healthcare using IT?
Yeah, so we've talked a lot today about data and analytics. I think you know, the EHRs and the modernization to electronic health record systems are great because they are a new innovative way to collect information, but they only really capture part of the data, right? Being able to look at a single patient is great, but it would, you know, in the future, I see where the clinician can look at a cohort group, show me this patient with these diagnoses that have the same demographics, and being able to then define a clinical pathway more efficiently, and doing that at the point of decision. And with the millennia, I see a lot more mobile usage as well, where not only is a doctor walking in with a laptop to collect your information, but they're also making a critical decision at that point in time in the operating room with all the information in front of them. I also think a really interesting sort of data set is all of the wearables that we're wearing, and being able to incorporate that into a clinical pathway for a patient as well.
Yeah, I think so too, and I think you know, it seems to me like, you know, we're getting to a point where we should be able to be sharing if symptoms somewhere in the world look similar to symptoms somewhere else in the world, some way to get that information from one point A to point B, so that they understand, you know, they're dealing with something very, very similar, and we find cures and so forth. Dr. Neil Evans, where you see this all going down the road? What's it look like in the future to you?
I think in VA, we seek to deliver personalized, proactive, patient-driven healthcare today. And I don't think that's going to change at all in the future, but I think that health information technology is going to change what that means. Personalization of your healthcare means it becomes more about you. Proactive, we will be able to use analytics to proactively reach out to our patient population and manage their health before their health becomes a need for health care. And patient-driven means that the patient increasingly is in the driver's seat. I think as we move forward, we're going to move beyond the concept of the episodic visit as the anchoring point of healthcare. And in the future, care, virtual care, health information, and self-care tools will be available to people. We won't even call them patients, to citizens, for us, for veterans, continuously as they live their daily lives, to be able to have access to personalized, proactive, patient-driven health.
I love that. You know, I think it just makes so much sense. If you can get proactive and you get the care in place before individuals actually get sick or need health care, you're going to do a heck of a lot just for the system itself, you know, with individuals taking care of themselves, relieving the burden on the healthcare system itself. Jeff Baxter, NetApp, but what's your crystal ball look like? What's it going to look like down the road in the future? Where's this all going for us?
Yeah, my crystal ball, it's sometimes cloudy, but if I knock on it a few times, you know, I think we all kind of have the same basic vision here. We all want end users, we all want medical professionals to have access to the same data, right? Whether it's in the war zone back at a VA clinic with a commercial care provider, you know, and now increasingly at home, right? Or wherever you may be, hopefully not while driving. And then at the back end, we want that data to be shared freely among different infrastructure, right? So we have this multitude of options on the front end of how that data is going to be accessed and used. We have these multitude of options from individual agencies to clouds, even out to hyperscalers like an Amazon or an Azure. I mean, all these different places where data may be consumed. And so what we're really focused on, and we think what's going to make or break that, is that sort of data fabric in the middle that links all of those. That's the, if not common language, at least common translation layer, right? We see examples all the time in real life of how data fabrics have made, you know, modern modern life possible. I mean, I flew over here from California, right, and I probably got handed between 10 or 20 different air traffic control towers, and if I had to know every time that happened, I'd probably be scared to death, right? But I never knew, right? There was a fabric in place that took care of that for me, right? Or on the commercial side, right, what Apple's been able to do and what's made them so successful is they may have 3 different operating systems in this huge multitude of devices, but at the end of the day, they've created sort of this personal data fabric for me, right? So that all my devices talk together, all my information is shared, right? So probably not as easy on that when it comes to medical data and to an enterprise data fabric, but that's fundamentally what we need to emulate, right? Is have that data accessible from all the different endpoints and have it be able to be stored wherever it makes sense based upon the value of that data, who's going to need to access it and when they're going to need to access it. So that's really our vision for the future is if we can get that in place, right, that enables a whole bunch of different transformative events to happen in this industry.
Absolutely. Ubiquitous data available wherever it's needed.
Absolutely.
Dr. McCoy, what's it look like to you down the road? Where's this all going? What's the future going to look like as a result of these efforts that are going on here?
Individual care, individual person-centric care supported by the delivery system reform. That includes payment to clinicians for outcomes and hospitals for outcomes, not doing certain procedures, doing excessive documentation, et cetera. It is the precision medicine initiative as announced by the president a few months ago, where we have the intersection of genomic medicine and other omics, giving you the right medication that your genotype requires. All those things are going to lead to a healthier outcome, a healthier country with the right information being provided for appropriate care.
Yeah, I know there was so much hype around the Human Genome Project and things that are going on and all the promises there. And I think every day you're reading about new experiments going on, new breakthroughs. I think just recently of things about new cholesterol drugs coming out that are going to revolutionize, treatment of cholesterol and so forth. So yeah, it's exciting times, and the technology is certainly adding to the excitement. Dr. Bowen, let's talk about the future and where you see this all going. What's it look like to you down the road?
Thanks, Jim, for bestowing that MD degree on me. Appreciate it. Let me talk about a couple things really quickly, and my fellow panelists have touched on it. Before joining the DoD, I was a CIO at the Federal Aviation Administration, and when you talk about aviation and what's been happening there, the airlines for a number of years have been using telemetry to monitor the status of their aircraft, as have the engine manufacturers. And when I look at things like, and I just made some notes here, Fitbit, Progressive Insurance has got a gizmo that'll, you stick in your car and it'll tell you how you drive. The new Apple Watch, I think, is going to take your pulse and is already connected to the internet, and sort of all the emphasis on preventive medicine and getting away from responding to an incident to a more proactive way of caring for the patient. I think we're not very far from a situation where you're going to wear a device that'll be communicating back to some provider that you designate that will be regularly sending your information back there. I don't think we're very far from that at all. And I guess the other thing that I would mention is all of our systems are hospital centric or provider-centric, and I think we've got to move to a situation where our systems are really much more around the individual. As Dr. McCoy alluded to, some genomics and where the repository of the information really resides with the individual. And when I show up to my provider with a database of my information, and he uses that to treat me, and then if I go to a different provider, then he gets to use that information as well. So that's kind of where I think we're going, much more patient-focused rather than incident-focused or provider-focused.
Yeah, I'll tell you, that's come across loud and clear, this patient-focused emphasis. Let me try to do, like I always do, try to do some summaries here before we close out the show. We talked about progress, and what came across to me is analytics are playing a big role in the progress. Better analytics and analytical tools and are moving us to better point of care using data in order to We heard on progress about telemedicine and the need, how telemedicine can make dramatic improvements in reaching folks and providing health care to those that maybe are in situations where it's difficult to get to a provider facility. Some of the specifics, standards and interoperability came across as two key things that need to be looked at. We heard a real nice, noble story about free vaccines for veterans at Walgreens. I thought that was a very interesting, specific thing. We heard about secure messaging solutions and how important it is if we can get secure messaging moving around, then we can move this health data around and feel confident in doing that. And we heard about big helping small. There was a messaging here. Some of the bigger providers were able to offer things and then pass them on down to smaller providers in order to help them get on board. Lessons, standardization and consolidation remain big issues. Engagement of the consumers came across loud and clear as something that's important in collaboration with them. Focusing more on the people rather than technology, person-centered approaches. We talked a little bit about the role of the clouds, plural clouds, as well as culture change came up pretty much throughout the entire show, and just how tough that is, especially came up in the challenges section. Also in challenges, we talked about cost, compliance, commitment, and competition being key items that are challenges out there. Future, what I heard, movements towards personalized medicine, proactive healthcare, trying to get out there in front and keeping people healthy so they don't get sick, and focusing on outcomes, which I thought was a very interesting point to focus on what outcomes are we trying to achieve as opposed to traditional ways of looking at things. With that, I first want to thank my panelists here for taking time from your busy days. I know you're all very, very busy individuals. Thanks for taking time to come out to share your thoughts with us on the show. Thanks to our sponsors, without which we wouldn't have a show. So thank you for doing that. Thanks to all the great people here at Federal News Radio that do such a great job accommodating us. And most importantly, thanks to our listening audience that are out there that are tuning in and listening to the dialogue as we do these, what I like to call knowledge sharing sessions to try to keep everybody in the community up to speed on what's happening. You've been listening to the Federal Executive Forum on Federal News Radio, 1500 AM.